What keeps me inspired and committed to this clinic really is our commitment to quality and our commitment to compassion. And everybody who's involved, from the board to the staff to every volunteer to every patient, there's a commitment to treating each of us with dignity and respect and compassion. I think at Clinic by the Bay we really put the heart back into healthcare. And I believe that, and we're doing that every single day. And that's what keeps me coming here every single day.
My name is Omar Hernandez. I was 55 when I lost my job, so I went with the health plan that I had for 20 years. Right before I lost my job, I was diagnosed with arthritis, so I couldn't get treatment.
Él tuvo una depresión con la falta del trabajo. Y yo creo que también eso le produjo la enfermedad y se le vino muchas cosas. Pues se me hacía duro porque tenía que tomar medicinas y no las podía adquirir.
It's a matter of buying medicine or buying food. And if you need the medicine, well, you have to give up the food.
Cuando él vino aquí, todas las enfermedades que él tenía de poco a poco las fueron controlando y todo eso. Eso le ayudó mucho a él.
Medicines, the attention helps. Every little bit helps.
Así que creo que mientras la clínica exista, nosotros vamos a venir aquí siempre.
I'm Pam Hemphill, and I volunteer at Clinic by the Bay, which is a free clinic for the working uninsured. My medical background is emergency medicine, and I was in the emergency room for 20 years as an ER doctor. I like to ride bicycles, and I was riding bicycles with a group of women, and one of them told me about a volunteer opportunity at this clinic, which was about to open. And so I started by going to some events, and I started volunteering, and I've kept on volunteering and expanded my volunteering. I think they mainly try to put off medical care, but then things will come up. Their diabetes, which maybe they don't even know about, causes a problem, and they end up in the emergency room. And I think part of our goal is to keep people out of the emergency room. The other day, I had someone with an abscess that would have gone to the ER. I drained the abscess, and then the person came back twice to be followed up to be sure everything was going okay. And one of the doctors who still works in the ER said that would have been $4,000 for this person. I'm interested in people. What you get here is you find out about people, and they give me back their lives, their stories. I learned that the guy who's cleaning the pool in Walnut Creek has to get up at 4 a.m. to get the bus to be there in time to do his job.
I'm Eliza Gibson. I'm the Executive Director of Clinic by the Bay. Patients aren't patients, they're our friends and our neighbors. As an organization, we don't take any government money and we don't take any insurance. The truth is the clinic is built as much around the volunteer experience as the patient experience. Everybody you see here at the clinic is more than likely a volunteer.
I learned about the Clinic by the Bay I was walking by Mission Street, and somebody handed me over a leaf flyer, some sort of a flyer. And being without a health provider, I said, wow, this is wonderful. So one day I went in, registered myself, and luckily they took me in. And that very first day I was being seen by the doctor that I have some health issues that I didn't know actually. And after a series of visits and checkups, yeah, here I am, healthy and still kicking. I'm employed, but the thing is, the cost of getting a health provider or health insurance is so prohibitive, which is beyond my reach. What I've been doing was self-medicating myself, anything that I can buy over the counter. So without Clinic by the Bay, I don't know if I could have made it this time. I would still be here talking to you right now. I don't think so.
So the goal is to invest in creating meaningful opportunities for civic engagement. By investing in good volunteerism, you're going to provide quality care. And what do we need to be able to do all this and continue to operate and do what we do here at Clinic by the Bay? We obviously always need volunteers, more people who want to get involved in our neighborhood solution. We need physicians and providers. We need dentists and dental hygienists. We need receptionists and interpreters. And at the end of the day, we also need support. We need philanthropic support. We need people who want to get involved and join us in being part of a neighborhood solution to the healthcare crisis.
And I've heard that most of the staff, even the doctors, the nurses, are doing it for free. I mean, you know, out of the goodness of their hearts, they try so much to help uninsured, and I'm so thankful with Clinic by the Bay.